Next, a day in the life of an international medical team working in one of the most remote flood zones in southern Pakistan. Special correspondent Saima Mohsin traveled with a team from Médecins Sans Frontières, MSF, also known as Doctors Without Borders. A warning, some of the images in this story are quite disturbing.
Cut off and left to fend for themselves, 2,500 families have been stranded on the border of Sindh and Balochistan since the floods first hit in August, until MSF discovered them.
There were two persons coming. They went by car when it was possible, but this road was completely flooded, so they went through the water. And then they had to take a boat as well. And they took, I think, the boat, and they went by horse as well, I think. And they were reaching the place at the canal, and at the canal it's possible because there are two big roads. So then they could continue by rickshaw, I think. And when we came the first time, it was already accessible by car, so we didn't have any problem. And for us it was important because we have all the medicaments. We have one truck with all the supply, so it's necessary to have a road to have access.
Sylvie Bachmann is a 30-year-old nurse from Switzerland who's been working with MSF for the past 2 years and came to Pakistan as part of the flood response team. The road is narrow, bumpy and precarious. Much of it is washed away with only enough room for one car, but this is a two-way street. It takes us 5 hours to get to Imam Baksh Jamali from MSF's base in Sakkar. It's uncomfortable and tiring, but the hard work is yet to begin. Stealing the shade of a tree, the team gets to work immediately. There are 2 doctors, 3 nurses, 2 dispensers and 4 health educators overseen by Sylvie.
Over there we have the triage. There is one person responsible to check the patients. All the patients are waiting there. If there is a child with high fever, for example, or we can measure with this thing how it's the nutrition. If it's severe malnutrition, for example, we can see it quickly, then they can come first. Otherwise, all the patients from there, children and adults, they can come to the doctors. We go to this table. The doctors, they take the history, they write down the medication they need, and then from the doctor, if it's necessary, they go to the nurse. The nurse can do dressings or malaria check. And after this, they go to the dispenser. The dispenser has a medication. He is going to give the right medication. It's written on the card, and he is able to give it to the patients. He explains how to take the medication.
Lined along a canal 25 kilometers long, thousands of people are living in shacks made from sticks and blankets. They'd been here for 8 weeks, surviving on what little they'd managed to salvage and a few bags of food they'd managed to catch from the military's initial aid drops. Cuts and wounds are finally being treated months after they first appeared. Children are tested for any serious conditions. Malaria is an increasing concern.
We have mostly skin diseases. We have upper respiratory tract infections, and we have about 6 to 8% malaria cases.
How worried are you about that?
It's quite a big number, actually. It's because the people that are living here in the tent, they don't have any protection of the mosquito. We were distributing mosquito nets, but they're using now, they start to use it, but we are still teaching them how to use the mosquito net in a proper way.
We met Zarina. Her daughter is 3 years old, lethargic and doesn't eat. They've been here for 2 months without any help.
Whatever we had is gone. All we could save is our children. Nothing else. I've lost my parents, brother. I have no idea where they are.
And you stayed here, but no one came to help?
Yes, we've had no help and no idea if my family are dead or alive.
The local doctor is recommending Zarina's daughter has an immediate blood transfusion, but MSF wants further investigation before making such an important decision.
I'm worried about my child. If they are ill, I am ill. And if they are nothing, I am nothing.
The people here belong to both the Sindhi and Baloch provinces and speak at least 5 different languages, which can be difficult when trying to understand complicated medical conditions.
I all the time need a translator because I don't speak any Sindhi or Urdu. And as well, sometimes there are misunderstandings, even if they speak English, but it's difficult to communicate properly. And with the patient, sometimes they don't ask exactly. For example, when a baby has diarrhea, the mother says, yes, it's having diarrhea, but we really have to make sure that it's really diarrhea.
Working in conjunction with local medical staff is the backbone of MSF's work. Communications is just one of the reasons.
We want to train them that they know how is MSF working, how we do it in Europe, so they can learn it, and when we leave, MSF is leaving, then they can continue with the same work. We want to give them the knowledge to do it in a proper way.
I learned many things from MSF. First we are starting work in Sakkar for feeding, and we open their feeding center, and I learned how to feed the baby, and I learned how to educate mothers about feeding and about hygienic condition of the baby.
The team has only a few hours to get the much needed treatment to the flood victims. They have to pack and get back to base before nightfall because of highway robberies. Back in Sakkar, MSF has set up a nutritional program to tackle the devastating malnutrition in the area.
What we do is we have teams that are screening within the camps, and when they find severely or moderately malnourished children, and there are no medical complications, we're able to provide right away a regimen of therapeutic food. It's called pumping out basically, and it's a ready-to-use food. There's no water that is necessary. The child just opens up the envelopes and eats it. It's kind of like a peanut butter paste, and it is high in vitamins and all the necessary nutrients for the child to grow rather quickly and gain the weight that is necessary. And when the children do have severe medical complications, then they're referred here to our intensive feeding center where we have to treat the child for medical complications and also for malnourished.
Too weak to cry, babies are only spoon-fed drops of water here.
So the problem with this one is it has more than a month profuse diarrhea. So another kid we have to be very patient with, and what we are doing is trying to get the GI tract working again with little bits, because in other hospitals, I mean, they're good hospitals, they're proper hospitals in Sakkar, they get the medical care, but if they see a child like this, it immediately gets a drip.
Yeah.
And then the kid is a little bit better, but when the kid goes home, of course, they fall. Because with the drip, you never train the GI tract to start working again.
GI tract, you mean
the stomach and the intestines. Yeah, it's a gastrointestinal tract. So you need to train that. And if it keeps diarrhea for days and days, you have to look for the cause of it. And mostly a kid that comes from other hospitals here has seen every antibiotic in the book already. So it's not a question of giving more antibiotics. It's much more observing, but it's out of the danger zone now. Anyway, let's go and see this baby. This is one of our, is actually a problem child. Can I see the baby, Mama? Yeah, this little one. She's doing quite well right now. It's a 4.5 months baby who had a failure to thrive actually since she's born. Typical for many of the babies we get in the young children. It's the week.
How old is she?
4.5 months.
Tiny.
Yeah, 2.2 kilograms. And when it came here, it was 2.0, so it's already a success. But it's typical for many of the kids we get. It gets worse because of the flood situation, but the ones that fall first are ones with some comorbidity, kids that have some other reason for failure to thrive, as we call it. And This one needs a lot of patience, of course, and a lot of extra feeding. But she's doing well.
How does she compare with the size of a normal baby? I mean, in terms of the limbs and...
Well, the average weight of a child born in the United States is much more than the weight this child has now. It's very well. You can see the little arms. It's just all very, very weak. I mean, but the face is the most impressive. Is the sunken eyes, the big eyes, and you know, the grandfather face.
And we saw many more babies in a similar condition that day. Water levels remain high in many remote areas of Pakistan, in particular in Sindh, and with it are thousands of people cut off for weeks on end, waiting for help.